Welcome back, ladies and gentlemen. This is the Risk Academy. Today we're going to go over Chapter 3, and specifically we're going to talk about a risk program versus a risk process versus a risk analysis, and what the three mean. People use these terms interchangeably, and they're not. So we're going to talk about them a little bit more in depth to help you understand, so you can kind of figure out how you need to put them in. I'll give you a hint. They're kind of in a row. Program comes first, then a process, and then a specific analysis. So we'll go through all of these in these next slides. Okay, so we've talked about the three. Let's start talking at what we need to have from the top down. The risk management program. This is actually the structure, the business structure, and the processes, policies, everything we need to actually have the risk management happen in your organization. Okay, so for example, we talked about governance in the last chapter and the 7 things that you needed to actually set up this risk program. The first 5 of which are all about the administrative and the business structures. You aren't actually doing anything yet. You're setting all of that up. Your risk program, by the way, is how you take those 7 things and get them implemented. So for example, on 7, they talked about an implementation team. One of the things that you should do under the governance portion of this is create a risk committee. Now, if you're a very small organization, that may be a risk committee of 1. For all larger organizations, it could be multiple people. Risk committees are made up of typically the people that manage the risks on a day-to-day basis, the responsible parties, but they also are consulting parties or the subject matter experts. So for example, if you have a triage call-in center, the person who runs that probably needs to be on that risk committee so that they can represent their business unit. Your actual folks that manage your clinicians that are going to the facilities, they need to be on here. For example, if you have a contractual risk where you are a medical director for a facility, you need to have someone from that standpoint on that risk committee so that you can represent the management pieces for the actual medical director on there as well. So risk committee is very important. They also need to meet on a semi-regular basis, whether that's quarterly, monthly, semi-annual, or annual, depends upon your organization. So this governance, and especially that risk committee, it's setting up the structure for you to actually do the work. Another piece of the program, you need to have good policies and procedures. Two of the 5 pieces of information that you need to run your business. Okay, the pieces of paper, the documentation that you follow, you're basically setting your rules to run your business by. You need to have good policies and procedures on how this risk management program works. The policy about it, actually how it will function, broad-term, long-term, strategic, and a procedure is actually sort of this is the steps in which you follow on how to do these things. So the program actually is about the structure in your business to get the work done. Does not actually give you a way to do the work yet, okay? But this is actually about getting the business structure, everything in place, the governance, everything so that it can get done. All right, ladies and gentlemen, so now we talked about the program, setting up your actual business structure to things take place. Now we're into number 6 on that list from the last of Chapter 2, and that's picking a methodology, a risk management methodology, or a risk management process. A methodology, a framework, any of these things are literally just a structure that somebody has created that allows work to get done. So it's literally a structured way of getting something accomplished. plenty of methodologies here for risk management process. These are all things you can freely download from the internet. They're huge. They're, ISO 27000 or 27005 is like 600 pages long. They're extremely complex. They're designed for every business organization out there. So they kind of cover all the bases. But these are methodologies that you can actually use. These are some. There's more. By the way, our next chapter, we're going to talk about why these aren't the best for healthcare. But I just want to let you know they're out there. There are ways. You don't have to recreate the wheel here. Okay, folks, so now we've talked about a risk process and different types. I actually drew one up here on the board. This does not need to be the one you use. This is just one so we can discuss how a process works. Now, these 5 areas need to be in your process somewhere, but they do need to happen. So the first thing we do, obviously, is set the scope of what we're looking at. From our guidance structure, our governance structure, does the scope cover financial risks? Are we talking about falls assessment? Are we talking about something IT related? Setting the scope. The next thing we need to do in our process is we always have to identify our assets. We're going to have a whole chapter on assets. Just understand that an asset is something that has value to your organization. Sometimes it doesn't mean money, but it does add value to your organization. The next thing we do is then we actually do the risk analysis. That is an in-depth look at a particular asset and finding a risk and then analyzing it so that we get an idea of, is this a big risk? Is it a small risk? Is it a high risk, a low risk? Is this a $10,000 risk or a $10 risk? So we look at it and we analyze them. And that's where we actually come up with this list that says, for most people, it's medium, low, high. These are risks we need to take care of. Then you develop a treatment plan. Risk treatment. What are we going to do? Okay. That risk treatment takes into account things like your risk tolerance or your risk appetite of your organization. So it may be that after you've identified, from the risk analysis, there's this risk we need to worry about. It's low, and we're okay. We'll accept it. We'll talk more about actually treatment plans and things in another chapter as well. And then once you get done, you have something called a residual risk, because unless you stop doing business completely, you've always got some risk of something with an asset. There's always a risk to it. It's just how high of it is. The residual risk is what happens after you do something to it and you bring it from a higher down to a lower. You can equate this to a falls assessment. You do a falls assessment on a patient in a nursing home. You make sure they've got the additional assistance they need, but that still can't stop them from falling, all the time 100%. There's still a smaller risk that they'll still fall and are at that risk of having an injury from that. But you've put additional things in place to help reduce that risk. Residual risk is all about the reduction of risk and where the risk level is after you put things in place to make sure that it does come lower. All the time, we're communicating back and forth to those who need to know. And we're monitoring this. Someone needs to manage this process. They're responsible for making it happen. So somewhere someone needs to monitor this. So the person responsible for this risk process monitors this to make sure things keep going the way they're supposed to. And the communication part is to make sure that the people in the governance, when we talk about the communication piece, this happens so they understand as a business where our total risk is. All right, so we talked about your business structure in a program, and we talked about picking a process to follow, okay? So now we're actually talking about the one piece in that process, which is the assessment or the analysis part. Okay, so this is actually putting a focus to individual things and coming up with a decision about how high or low of a risk, if you use high-low classification, the quantity of risk, if you're using dollars, for example, to identify your risks. However you choose to make those risks classification, that's what we'll use. So the assessment and the analysis piece literally starts looking for threats, vulnerabilities, and exposures. Okay, those are technical terms that you see. I like these better. It's the likelihood and the impact. So the likelihood and the impact that something will happen. An example would be, if you think of threats, vulnerabilities, and exposure, if you're in Florida and you have a building in Florida that's next to the intercoastal waterway, so if you look at the threats, what kind of threats would be there? Obviously, if it's close, flooding would probably be one of the things you would think of first. But you could think of all the natural disaster threats. What about a tornado? What about a hurricane? So you can kind of figure out, I've got a threat and I'm vulnerable in flooding case. If you're 10 feet from the intercoastal waterway, I'm probably pretty vulnerable to flooding. What's the exposure if that happens? I like the term likelihood. And the impact. What is the impact if you have something happen to the building? Oh, it's a high impact. Well, what happens if, an earthquake? What's the likelihood of an earthquake hitting you? Pretty low. So you'd probably say that it's a low if you're doing a high, medium, low scale. Or, 1 to 5, if you rate everything 1 to 5, that might be a 1. If you're talking about a flood, that's probably pretty high likelihood you're going to have a flood because Florida hurricane storm surge. Happens all the time. Happens multiple times a year, in fact. So then you have to determine, okay, is that a 3 because our building and the way they built it is geared to handle this and there's retaining walls and so on and so forth, and it takes a 50-year flood, or is it kind of on a bank that it can just run up and run into your building? So that likelihood, is that a 3 or a 5 on the scale if you're doing a 1 to 5, or is that a medium or high? That's for you to determine. That's what we're trying to do here, is gauge our level of risk and actually put it on a piece of paper or an Excel spreadsheet or what's called a risk register. And think of it just an Excel spreadsheet. We actually list this out. What's the risk to this? We're trying to identify these things as the level of risk. So we know a flood risk on our building would be high. An earthquake risk on our building is low. Then as we go through the rest of that process, we could say, oh, we need to develop a treatment plan for this, we can accept that, and so on and so forth. But that's what the assessment analysis is literally about, taking the deep dive on specifics. It's not a process you follow, it's the actual, sometimes you hear this term, doing our due diligence, doing our research. It's the deep dive, and then we make a determination of the level of risk. And once we have this sort of document or spreadsheet or a piece of paper with everything listed on it with our level of risk, then we can look at it and say, well, we've got all of these ones are high risk and these ones are low, or these are 5s, these are 4s, these are 3s, these are 2. It gives you what's called your total risk for your organization. Thank you, ladies and gentlemen, for watching this today. Hopefully you've learned a little bit about what the difference between the program, the structure, the process, which is the actual process you follow, and then an analysis or an assessment are kind of the same thing, that deep dive. So you understand what those actually mean. Coming up in our next chapter, we discussed risk methodologies, and I sort of mentioned why they don't quite fit healthcare, that round peg, square hole kind of concept. We're actually going to talk a little bit more in depth about it and why. That's what's coming up, is why do risk methodologies not exactly fit healthcare?